show you how to do goniometry for horizontal shoulder adduction. So in order for me to see this better, I'm going to stand up on this stool, and I'm going to line our large goniometer with her AC joint, and then I'm going to leave the fulcrum without the numbers to the outside instead of the in, so I can register just her shoulder movement and not excess movement. So I'm going to ask her to go into horizontal adduction to 90 degrees, and I'm going to align the other portion to the lateral epicondyle, and then I'm going to ask her to actively go as far as she can in horizontal adduction. So can you please go as far as you can? Alright, and then I'm going to passively, so that's about 105, and then I'm going to passively push her a little bit more to about 115. And that's considered normal. 130 is supposed to be the perfect, but you can optimally move it around 110. Okay, and now I'm going to show you how to do elbow extension. So what I'm going to have the patient lying supine, shoulder in completely neutral position, and put a towel over them to kind of give us maximal extension so it's not being blocked by our table here. And so what I'm going to do is I'm going to align our fulcrum to our lateral epicondyle of the humerus. And then what I'll have her do is actively flex her arm, so if you can move your arm up all the way to full flexion. Okay, now I want you to go into extension, so move your arm down. So she is at about 130 degrees past or active range of motion, and so if I push a little bit more, not too much, she gets to about 140, even maybe not too much, but maybe 143 I could probably get her to, but we don't want to hyperextend her elbow. And those are within normal limits and extending. Alright, so I'm about to show you how to do wrist radial deviation, goniometry. So what we're going to do is her wrist and her whole forearm is laying pronated on completely pronated on the table with really 0 degrees. We just want it completely neutral so we can get the most accurate rating and reading possible. So I'm going to align the fulcrum in the middle of the wrist, and I'm going to align it to the middle of her, like her middle phalanx. And then I'm going to situate it to where that is at 180, or 0 in this case. And I'm going to grab her hand along with my thumb on top and along with the lever. And I am going to move her hand radially, wrist deviation, radial deviation, and hopefully get an accurate reading. So if you could move the most you could to the side. Okay. Try to keep it as even as possible. So that's about, it's about 30, or excuse me, that's about 20 degrees. So we're going to see if we can move a little bit more. Thank you. And we got it to about 25 degrees. And that is within normal limits.
Hi, I'm Aubrey, and I'm going to be doing goniometry range of motion testing for MCP, or metacarpal phalangeal joint of the hand in goniometry. So the fulcrum is going to be lined up with the dorsal aspect of the hand. The stationary arm is going to be in line with the forearm. And you're going to line it up with 0 in line, the measurement arm in line with the index finger. You're going to have the athlete actively adduct their finger, which brings it to the midline. If I was to passively do it, I would bring it back myself. So for the athlete to actively adduct their finger, I'm going to remeasure, and then the athlete measurement is about 20 to 25, which is within normal limits. Next we'll be doing the goniometry measurement of the carpal metacarpal joint, or the CMC joint. The fulcrum, first the athlete needs to be in normal position, in supination, without ulnar or radial deviation. Next, you're going to align the fulcrum on the palmar side of the first CMC joint. The stationary arm needs to be on the radius, the midline of the radius, and then the measuring arm needs to be in line with the CMC joint. Next, you're going to have the athlete actively flex their thumb, okay, and then you're going to remeasure, and then you're going to evaluate. And it's about 15 degrees, which is within normal limits. All right, the next one we're going to do is flexion of the MCP, or the metacarpal phalangeal joint. You're going to put the athlete in supination and relax on a table. You're going to have the fulcrum on the dorsal aspect of the MCP. You're going to have the stationary arm on the proximal aspect of the MCP and the measurement arm on the distal aspect. And then you're going to have the athlete flex the MCP. Then you're going to remeasure right here. And it is going to be about 45 degrees, which is within normal limits.
I'm Michaela Coffey, and today we're going to do hip extension goniometry measurements. So you're going to line the fulcrum with the greater trochanter, which is right there. And then the stabilizing arm is going to be midline of the pelvis. And then your movement arm is going to be in line with the femur. So I'm going to ask you to raise your hip. Okay. All right. And it is within normal limits, which is 20 to 30 degrees. All right, next we're going to do knee flexion. All right, so your fulcrum is in line with the lateral epicondyle, and your proximal arm is in line with the femur, and your movement arm is in line with the fibula. So now I'm going to ask you to bend your knee. All right, and actively is within normal limits, which is 150, and you can passively move it a little bit more. All right. Thank you. Alright, next we're going to do ankle eversion. Your fulcrum is going to be in line on the anterior aspect of the ankle, distal between the two malleoli, and then your stationary arm is going to be in line with the tibial tuberosity as a reference point, and your movement arm is in line with the second metatarsal. So I'm going to ask you to evert your foot. Alright, and she's within normal limits, which is 15 to 20. Next we're going to do toe flexion. Your fulcrum is in line with your MTP joint. Your stationary arm is in line with your first metacarpal, and then your movement arm is in line with the proximal phalanx of the first toe. So I'm going to ask you to flex your toe. All right, and she's in with normal limits, which is in 30 to 40 degrees.
I'm Victoria, and I'm going to be doing cervical flexion with the double anklometers. So for the first one, I'm going to have on the spinous process on the T1 vertebrae, and I'm going to make sure that I have this aligned on 0, which I do. The second one I'm going to place firmly on top of the head, and I will align that with 0 as well. I will instruct the athlete to keep their trunk straight, and I'm going to get her to actively flex her neck. So actively flex your neck. And I'm going to take the difference between the two anklometers, and it gives me 45 degrees, which is within normal limits. So the next test that I'm going to be doing is cervical rotation. So I'm going to take the goniometer, and I'm going to place it firmly on top of the athlete's head. I'm going to align the stationary arm and the measurement arm in line with the athlete's nose. And she has a candy cane to help me align. I'm going to hold this firmly, and I'm going to instruct the athlete to either turn her head to the left or right in a rotation. So turn your head to the right for me. And from there, I'm going to move the measurement arm and line it up with her nose, aka that candy cane again. And I'm going to take the measurement, which is 74, which is within normal limits. The next test that we're going to do is for thoracic lumbar extension using the anklometers. So for the first one, I'm going to have it placed on the T1 vertebrae, ensuring that it is lined up with 0, which it is. The next, I'm going to line up with the S2 of the sacrum, which is about right here. And that will be lined up with 0 as well. Next, I'm going to get the athlete to actively extend her back, so I'm going to ask her to lean back for me. Ooh, okay. I'm going to take the difference in between the two measurements, and it gives me 35, which is within normal limits for a female of her age.